So it was just 6 months ago that the director of the World Health Organization assured the world that mass lockdowns were absolutely necessary to stop the coronavirus. You might want to live your life, continue with your job, see your elderly parents. Tough. It's time for a new normal, Dr. Tedros told us.
People in countries with stay-at-home orders are understandably frustrated with being confined to their homes for weeks on end. People understandably want to get on with their lives because their lives and livelihoods are at stake. That's what WHO wants to, and that's what we're working for all day, every day. But the world will not and cannot go back to the way things were. There must be a new normal, a world that's healthier, safer, and better prepared.
A new normal, says Doctor, who's not actually a doctor, Tedros. We can't go back. That was a lie then. It's very clear that it's a lie now. Anyone who looks at Sweden can tell you that was a very, very bad idea. So last week, Dr. David Nabarro, who's the WHO's special envoy on coronavirus, came out and admitted it. Lockdowns are not a good idea, Nabarro said. They never were a good idea.
We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. Look what's happened to smallholder farmers all over the world because their markets have got dented. Look what's happening to poverty levels. It seems that we may well have a doubling of world poverty by next year. We may well have at least a doubling of child malnutrition because children are not getting meals at school and their parents in poor families are not able to afford it. This is a terrible, ghastly global catastrophe, actually. And so we really do appeal to all world leaders. Stop using lockdown as your primary control method.
So our leaders are so stupid, so reckless, so completely insulated from the consequences of the decisions they make that they doubled global poverty in 6 months. Good going, guys. Will anyone ever trust these people again? Why should we? Why are they still there? Dr. Mark Siegel has watched this whole thing from beginning to end. He was the first person to interview the president on camera during his recovery. He's the author of the book, COVID, The Politics of Fear and the Power of Science. We're happy to have Dr. Siegel on with us tonight. Hey, doctor.
Hi, Tucker. I'm going to talk about the WHO and Dr. Nabarro tonight, and also about a poor restaurant owner down in Kilgore, Texas, a personal story. In terms of the WHO, in my book, I talk about Dr. Nabarro. Did you know that in 2005, he saber-rattled and said bird flu was going to could kill up to 150 million people, scared the entire world, fear-mongering. He's still there with the WHO, but go forward 15 years, and as you know, the WHO did not warn the world for an emerging pandemic this time around. And then, as you just showed, Tedros said, stay in your lockdowns. You need the lockdowns. But I'm very happy today to see Dr. Nabarro come out and say, look, lockdowns can help a little bit as you regroup, or if your healthcare workers are exhausted, but the cost is enormous and they should not be a primary strategy. Stick to your masking and your distancing. I'm so happy to see this turnaround. They're not a reliable group. This is very correct. But let's look at the United States for a minute and how it's affected the United States, Tucker. Restaurants, the National Restaurant Association said last month that 100,000 restaurants are already closed, and 40% of restaurant owners say they can't keep going more than another few months. That is going to be a major economic disaster just in terms of restaurants. And I want to talk about one restaurant owner down in Kilgore, Texas, a woman named T. T owns a bar and grill that can't seem to get open because of the lockdowns, and she's gone through severe depressions, and she made a suicide attempt, and now she's turned to alcohol. I have a message for T tonight. T, listen, we know now, and we're learning that the fear from COVID, that the damage, the side effects are COVID, the side effects from not from COVID, but from the lockdowns is worse potentially than COVID itself. T, hang in there. We're on it. I hope we can focus on the lockdown damage, not just on COVID. Tucker?
Amen. Dr. Siegel, thank you so much for that.
Thank you.